What's going on, guys? It's your boy Brad back with another video. This is going to be an update on how things have been going for me in nursing school. I know I haven't put out an update in a couple of weeks, but figured I'd go ahead and do it. So I'm currently knee deep in Med-Surg 2. I'm learning a whole lot and I'm really enjoying this material. I don't know if you've been following me for a while. I've been watching my updates, but back over the summer, whenever I took Med-Surg 1, I've really said that was like my most favorite class because of the material that we're learning and how it's really going to be applicable to my career, as opposed to like Peds and OB that we just finished. So now that I'm in Med-Surg 2, I'm back in that lane. I'm back in that train of thinking, learning about all of the wonderful pathophysiologies out there, which is like my strong suit, what I really enjoy the most. So we just had our first exam. It covered a lot of cardiac stuff, which I am falling in love with. Whenever I took anatomy and physiology, the things that I really enjoyed the most were cardiac, endocrine, but we never really went into the kind of depth that we're doing now in nursing school, obviously. And so, there was a lot of cardiac on there, atherosclerosis, arteriosclerosis, heart failure. We had stuff about the eye on there, some different disorders, macular degeneration, retinopathy, cataracts, glaucoma, just some different disorders of the eye and how to treat these patients and what kind of clinical manifestations that these patients come with. And then there was also a little bit of psych incorporated into the exam as well. So really cardiac, the eye, and psych. Man, I'm loving cardiac. Like, I don't know, man. Something about it that's very intriguing. It's very interesting how it ties in, so many systems of the body. You have heart failure, and then you have pulmonary congestion, so the pulmonary system becomes involved, and then it backs up into the systemic circuit. You get ascites, hepatomegaly, edema, all of those things. The kidneys become involved. You got the renin-angiotensin-aldosterone system. That stuff is just wild, man, and I love it. I love all of the intricacies and the details of the diseases that you learn about, and that's associated with cardiac. So I've really been enjoying it, man. So anyways, had my first exam. Didn't do as hot as I had hoped. I got an 88, which was one question away from an A, but it's cool, man. It's all right. It's an 88, right? And if you saw my video, good grades don't make good nurses. The whole point is to say that as long as you know the material, as long as you're a beast when it comes to those pathos and, how the patient presents and how to treat those patients, as long as you know the information that is applicable to your practice whenever you actually get on the floor, that's all that matters. That letter on the piece of paper or that number on your transcript, it's not all that important. So I got an 88, but I'm happy with it, man. I've got one more lecture exam. If you saw from my last update, 2 regular lecture exams. So I've already done one. So I have 1 regular lecture exam left, and then I'll have a final. I don't really know what's going to be on this upcoming second exam. I haven't looked that far ahead. I'm kind of all over the place right now with clinicals. That's something I wanted to tell you guys about, is clinicals. My clinical experience in Med-Surg 1 over the summer was one of the reasons why that was my favorite course, because I got so much wonderful hands-on experience. All of the nurses were very willing to teach and take the time to show me things, and it was very rewarding, and that is the case even more so this semester. I'm really enjoying the clinical rotations, man. I'm getting to see a whole lot. I'm getting to do a whole lot. So what my instructor has been doing is we've been assigned 1 patient. We'll go in there and she'll have the list of the patients and she'll just start going through. We've got a 23-year-old female with breast cancer. We've got a 45-year-old male with prostatitis, whatever it might be. And as she's reading them off, you just say, I want that one. The way that it's been turning out is I have been leaning more towards critically ill patients, trauma kinds of things. I don't know. I'm really intrigued by all of that. I'm really intrigued with that critical care And so I've been gravitating more towards those kinds of cases, and I've really been enjoying it. And like I said, she wants to assign one patient to us, but she told us in a week or two, we're going to be bumped up to 2 patients that we're going to be responsible for. So what I have done is I've went ahead and said, I'm going to take on the full patient load that my nurse has. And so instead of just getting a report on my one patient, and then I go look up the meds and the labs and everything that I need that's pertinent information for my patient, I'm writing down a report for all 5 or 6 patients that my nurse has that day, and I'm looking up all the meds and everything and trying my best to transition into that actual role of the nurse, because obviously that's what I'm going to be doing when the time comes for me to be on my own anyway. So I feel like for me at this point in my nursing student career, it's best for me to go ahead and begin assuming those duties. So it's been really rewarding to be able to have 5 or 6 patients to choose from, or, to care for, as opposed to just having that one patient. And it's like, what am I going to do for the next 12 hours when I'm only caring for one patient? So yeah, it's really helping me get into the role of the nurse. I've been getting to do a lot of things, hanging IV fluids, heparin injection, pneumococcal vaccines, influenza vaccines, because it's that time of the year. I have yet to get the opportunity to start an IV or to start a Foley, but I have discontinued or taken out many IVs. I actually did one today. I had clinic today, so if I'm looking rough and out of it, that's why. But yeah, I actually also got to take out a Foley last week for the first time, and so that was interesting just to get to experience it. But things are really moving right along, guys. I'm getting a lot more comfortable with the computer system, with documenting. I'm going in there documenting just like a nurse would, everything that I need to: infection and precautions, safety, patient education, assessment, vital signs, all of that good stuff. As part of this mini-mester with MedSurg 2, we had to actually get checked off again on a more in-depth head-to-toe assessment. I got checked off on that, no problem. By the way, if you haven't seen my how to do a full head-to-toe assessment video, go check that out. Link will be in the description or up in the corner somewhere. You can just click on my channel, subscribe, and then go look at that video. But yeah, that's pretty much it, man. That's how my semester's going so far. This is technically a mini-mester. MedSurg 2, the first mini-mester of the 16 weeks, was Peds No B. I'm now in the second mini-mester, which is MedSurg 2. And things are moving right along, guys. I mean, I've got, 4 weeks maybe, and then I'm done with my first year of nursing school. And I've technically have 3 semesters under my belt: my spring semester, my summer semester, and my fall semester that I'm currently in. So yeah, man, time is flying, dude. It's mad crazy. It's like just yesterday, it feels like I was, attending orientation for nursing school, and feeling extremely overwhelmed with all of the information that we were getting bombarded with, and feeling very inadequate and uneducated, man. I killed it in anatomy and physiology, but when you get in nursing school, it's kind of a different ball game, and so you kind of feel out of your element, so to speak, and that's how I felt, and it's crazy. And especially even whenever you're in class and you're learning stuff, you're like, at the end of the semester, you're like, man, I don't feel like I've learned anything, man. What did I even accomplish? But as you continue, I'm looking back now, and I'm like, man, I've come a long way since first semester, since fundamentals. So just a little bit of encouragement for you guys out there who are currently in fundamentals and feeling like a rookie. You're going to learn a lot, guys, especially even if you feel like your instructors aren't teaching you a lot, or you're having to teach yourself a lot, or you just feel like you're not learning anything. You're going to be surprised given just a couple of weeks how much you've learned. So anyways, guys, that was it. That's all that I've got going on for this semester so far. I'm mad tired, so I'm cutting this video off. I hope you enjoyed it. If you are new to the channel, subscribe. I'm putting out videos every week trying to help you guys obtain your dreams of becoming a registered nurse. Anyways, I'm out. I hope y'all have a great day, a great week, and stay tuned for more videos, man. I'm going to keep them coming. Nurse Bass soon to be. Soon to be. Peace.